My name is Shuei Kozu. I am an assistant professor at the Department of Social Work at Southern Connecticut State University. I moved here 2 years ago from Boston, Massachusetts. I am a social worker, and while I was in Boston, I spent a good chunk of my adult life working in the healthcare field, especially with pediatric population. So last 14 years, I was at Boston Children's Hospital. First 10 years in neuroscience, neurology outpatient program. And then I moved to work in the community as a hospital social worker. And then last 2 years, I was a social worker for international health services, serving patients coming to Boston Children's from all over the world.
Can you tell us a little bit about what brought you to New Haven and your work at Southern Connecticut State University?
When I was at Boston Children's Hospital, I pursued my PhD. And a few years after I got my PhD, I still stayed in the hospital trying to figure out where I wanted to go, what I wanted to do with my degree. And then ultimately, I decided what I enjoyed the most was to teach. And then so I wanted to come to a teaching university instead of a research based university. And I wanted to teach students for whom education mattered so much. And then so not to come to a place where um, students feel it's their right to receive education, but that they work for receiving education. That was a student population that I really wanted to teach. And then so Southern was a great fit for me, having social justice as its mission. And many of the students who actually many of them are first time college attendees, and who's never even left, never even been to Boston or New York, 2 hours away, and work full time, and really grateful for the education that they receive. And then so that was very appealing to me.
What are some of the things that really motivate you or inspire you in this field?
Yeah, so to confess, I actually didn't know what really social work was. And then social work is not a well-known field or career in Asian countries anyway. Um, and then so from very early on, I have been involved in some kind of volunteer work. When I was in high school, I was in a volunteer club, visiting nursing homes. When I was in even after I graduated from college, even when I was working in Tokyo for a few years after college, I was also doing volunteer work part time, assisting a couple, a married couple. Both of them had physical disabilities, and then so when I thought about going to a graduate school, I wasn't really keen on going into like business sector, even though I was working for a marketing company. And so when I thought about my own passion and what I wanted to do, I realized I really enjoy helping others. And so I took courses in social work and psychology, and then eventually I ended up choosing to be a social worker because I felt like psychology really was a very narrow focus, whereas social work really look at bigger picture, the environment, the context. And then so that approach, that perspective um, resonated me better. So that's how I became a social worker. And then for several years, every time I introduce myself as a social worker, my families in Japan and in Taiwan and in China, they are like, "Oh, she's doing a volunteer work," and I'm like, "No, this is my career." Yeah, and I had to explain what I do.
Wow, what a challenge. There are so many impressions of what the work is. Some maybe there's some truth to, but maybe some that have no truth to it. And so to constantly be describing and explaining your, and in some cases possibly with family, even defending what you're doing, and understanding that this is a actually important, very needed. Um, um, industry is the wrong word, but field and professional work, is it's a hard thing to convey probably. I can imagine, just with my own background and as the arts program director at Yale China. um, I choose to share with my parents very particular aspects about the work and not so much about the others. But one thing, Dr. Kozu, I love, that we have, a shared value in, is this idea of social justice. And I was wondering if you could share a little bit more, about your work, in addressing, the various social issues that we face in New Haven, for example, and particularly, in addressing systemic, racial injustices through your work.
So, social work is a very versatile career where you can work in virtually any setting. So I chose to spend my career in healthcare setting. A lot of people work in, for example, public schools. Or people will have private practices, or there's so many in or in the community, and then so there's so many different areas that social work can get in. But we have this core value, which is that, and then beliefs that social workers are needed only when there are challenging situations. Social workers are not needed when everything is going well, right? So when we see people, that's when they're not at their best. That's, maybe when they are struggling with their addiction, or when they are dealing with their mental illness, and or when parents are considered as maltreating their children and children being taken away from them. And then so when we see these people, they're not at their best, they are struggling. And then so instead of judging people at where they are, and then blaming them, we strive to see them as a person in the context. What are their values? What are their strengths? And what brought them into their current situation, where they want to go, what they want to do. And so we are not there to tell them, you need to stop drinking, or you need to stop beating your child. How are we going to help this person um, the way that they want to be helped? That's our core value. It's not about us, it's about them. And then helping them see things differently. I never knew physical discipline was not okay. Well, then how can I teach you other ways that may be more productive in getting your child to behave in certain ways? And then so it's really helping them understand where they want to go, what are the resources available to help them, how to utilize those resources. And if we have this view, oh, this is a person who's addicted to drugs, this must be a weak person or person who's sick, and be judgmental, we wouldn't be able to help that person. And then so that's the core value of social work. And then so and it extends, um, and then that's why we look at the operations within the society. How is the society oppressing the person because of the skin color or age or abilities or sexual orientation, you name it. There are so many marginalized groups, and then see how that is interfering with the person's ability to be able to move forward. And then so um, that's how we are supposed to be looking at people, and then that's how we are supposed to create relationships with people to help them move forward. And then so when we talk about social justice, um, that's really the core, really the core value of the social work.
I was wondering if you could share a little bit about, the study that you're currently running, and just a little bit about the background and possibly how, those, in New Haven could participate.
Okay, thank you. Um, so with my colleagues and with an absolutely wonderful student, graduate student as a research assistant, we have a team, and then we are conducting this research study which is related to COVID pandemic, um, and microaggressions against Asians and Asian Americans. As we know, the previous administration continued to call this pandemic caused by China, and then calling it China virus, Wuhan virus, or Kung flu, and that put Asians and Asian Americans at risk for hate crimes and all other types of oppression, including microaggression. So we've seen in the news how many, they may not be Asian, they may consider themselves as Americans, or it could be Koreans or Chinese, not Chinese, Japanese, but whoever is perceived as Chinese are targeted. And they have been physically assaulted, um, and then became the victim of violence. However, what's equally concerning is microaggressions that happens on a daily basis. Microaggression often is a behavior, gesture, or comments and words that are not necessarily intended to cause harm or to be discriminatory. But from the receiving end, the impact is that this is not, there's something wrong with that statement. Or am I overreacting every time I come up? That person seemed to be avoiding me. Is that person looking that I'm a virus? So I'm the source of the infection, and then that makes you feel so uncomfortable, um, and then it just really bad feelings. But because it's not obvious, there's a little place that you can go. And then and then also with microaggression, when you catch somebody and then say, that's not a nice things to say, then there's a risk of, oh, that's not what I meant, you'd be being too sensitive, or oh, you're playing the race card or the gender card, right? And then so there's a risk of being victimized again for calling it out. And then so microaggression, especially the accumulation of exposure, will have huge mental health and then both physical impact as well. So we wanted to chronicle, since the pandemic happened, with the administration continue to blame China and general public believing that somehow Chinese people are responsible, and they should be avoided, or that they are contaminated, or that they are the source of infection, um, targeting or exhibiting not very friendly gestures or comments against Asian people. We wanted to see how often, in what kind of setting, by whom these are happening, and then how that impact their health-seeking behaviors when they need to ask for help for their health or for their mental health. So that's the research that we are conducting.
And I know I've been excited by the possibility of what the results can do, because I understand that a lot of changes get made because policies are made,
Mhm.
but policies require data.
Mhm.
So solutions need information. And so you are possibly providing some data. I'm wondering if you could share what you think could be done with the materials of the study, if it does call for an action
Mm.
to support those who are experiencing micro and macro aggressions.
Great. Yeah, thank you, Annie. So just yesterday, it was brought to my attention that Biden administration is going to address this issue. So President Biden, um, made statements that he wanted to address racism toward Asian Americans during pandemic with executive actions, um, and it could actually bring about policy changes. But the starting point is that they are asking DOJ to look at hate crimes that's, when the Asians and the Asian Americans are being targeted. But microaggressions are very difficult to capture. Just as I said, even the victims of microaggression do not know the words microaggression may not be well understood. And then so um, so when in the process of the study, when we asked people to spread the words and then share the survey link, a lot of people said, I myself didn't experience this, but I will be happy to send it out. And after they took the survey, they, given the examples of have you ever experienced ABC, they were like, oh my God, I didn't know those were microaggressions. Now they knew, and you can name it. And then so um, my hope, through this study is not only for the policy change, but also for people to realize what their experiences are and then to name it. And then also for, when we talk about the policy, how do we not only to capture the hate crimes, things that is obvious, that can the law enforcement can do something about it, but everyday life, everyday attitude, where do they belong, and then how can we address that, how can we change that so that people will realize what they're doing is actually harmful to the receiving end. And then so to partner with Yale China and come up with some kind of skit or um, discussion or something to raise awareness, and then giving people voices when this happens. How do you address that? That's my one of our goals.
Thank you, Dr. Kozu. And you brought up the connection that I probably should have led with earlier, which is what does this have to do with arts, which is kind of my portfolio at Yale China. And we both have a colleague who is at Yale. Her name is Dr. Eunice Young. And she uses what she describes as theatrical vignettes, skits of stories that have been written by Asians and Asian Americans about their experiences. Some of them are about intergenerational communications. For example, adult child um, studying in the US, speaking to parents in China, for example, and discussing some very difficult kind of cultural straddling um, conflicts, issues. Um, but she also dives into skits based on real stories of racism, of discrimination, of just kind of unbearable anxiety that cannot be articulated, and even from a cultural perspective, actively suppressed. And through her work, raising more awareness of mental health, um, intelligence, emotional intelligence, and putting some words around and practice around articulating that awareness of self. And so I thank you, Dr. Kozu, for being willing to share some of your great research, and I'm excited for us to potentially partner in this as well, in considering what sorts of resources could we put together that might support, for example, public schools in New Haven, possibly throughout Connecticut, in terms of raising awareness for the mental health challenges that Asians uniquely face. For example, the stories that might be untold, or possibly even ignored, having been told, so that we are um, able to feel good about being visible. And I hope that more conversations like this will support more people speaking up about their very real lived experiences.
Thank you.
Um,
And that's a good segue into our possible next project, right? So after this research wraps up, when we can chronicle um, how microaggressions are happening toward Asians and Asian Americans, given my background working with children and families throughout my whole career, my concern is how Asians and Asian American students are going to be perceived in the school. During the lockdown time, there's online courses. Are they being targeted for cyberbullying? And then when we come back to the school ground, will they be the target of actual physical um, bullying at school? And then so that will be something that we would also like to study and then see how parents deal with the school and giving parents tools and then resources to be able to address bullying properly with the school, and then also to educate school teachers how to address racially motivated bullying in the school setting. So that's what we are hoping to do.
That's really exciting, Dr. Kozu. I can attest to having heard many times over the kind of forms of more mild forms of discrimination. Some people would describe as microaggressions, but also some very real discrimination that occurs on Yale campus, for example, and but an unwillingness to report it or articulate it um, in kind of mixed company, so to speak. But it is being talked about in kind of Chinese cultural settings. So I think I really challenge this rhetoric, this narrative that Asians do not rock the boat. We should not be confrontational. Something that my parents have survived with, but I think it doesn't mean we're not experiencing those discriminations. So this is a very challenging, um, uh, this is challenging work to be doing. And I look forward to continuing to partnering with you, but also other members of the Asian and Asian American community here, so that we can work towards better social justice.
Mhm.
Dr. Kozu, is there anything else you would like to share with our audience today?
No, just thank you, Annie, for your friendship and for your partnership. It has been great honor to be working with you during last several months, and I wish you the best as you move forward in your program, putting together this Lunar Fest programs.
Thank you, Dr. Kozu.
Thank you.